everyone, today we're going to talk about acupuncture and stroke patients, and I'm excited to share this testimonial because what many people don't know is that in the 90s, in the mid 1990s, and also in the early from 99 to 2000, 2001, my primary focus was treating maybe at least 50 to 60% of my day at a specific community clinic, Samahan Community Medical Clinic. I was their first licensed acupuncturist. I treated a lot of post-stroke patients, and also when I was at Pacific College of Oriental Medicine at the time, which is now Pacific College of Health and Science, a lot of my patients, I would say at least 30-40% of them were some severe post-stroke patients. Some of them, one gentleman, he had, by the time I inherited him as a patient, he had three big files from his Western medical doctors, and I was an intern, and I was at least the third or fourth intern by the time I had seen him. And I remember the part where it said when he was being released, when his family and he asked to be released, that he wanted to try something else, something in the alternative medicine field, and they wrote down, "This is not going to work." And I remember that till this day. And that was back then, 1997, 98, when I treated him. And his was probably the worst stroke patient I had ever seen till this day. And he was walking. He was able to take money out of his wallet. He was able to sign his checks. He was able to smile with symmetry. He had come a long way. So today I'm not going to actually discuss that. That's just one particular patient that I remember. But there is one particular testimonial I would love to share with you today. I'll let the testimonial speak for itself. For those of you who don't know me, my name is Dr. Anna Dolopo. I'm a board-certified licensed acupuncturist and a doctor of acupuncture and Chinese medicine. This is my 26th year in practice, and here is the testimonial. So her daughter wrote, she has adult children, and her daughter wrote this. It's on Google and also on Yelp. Dr. Anna Dolopo has been treating my mom for ischemic stroke, brain hemorrhage with right side deficits. Ischemic stroke, brain hemorrhage with right side deficits. In my experience of interacting with Dr. Anna, I find her to be extremely receptive to getting my mom better and very warm towards her needs. She has excellent bedside manners and is very compassionate towards my mom's goals. My mom looks forward to going to acupuncture because I believe she knows she is benefiting from the care that Dr. Anna is giving. We have seen Dr. Anna D. since July 1, 2024, and the results so far are the following. This is the important part. Deprived sleep between 1 to 3 hours nightly to improved deep sleep uninterrupted for 6 hours or more. Big deal. Emotionally depressed to contentment and enjoys humor now and smiles. That's the second one. The third one is delayed cognition recognition to real-time responses with recognition. The next one is improved kidney function and lung function with her organs showed signs of distress through labs/X-rays. So in that part, there are quantifiable results that the doctors are showing. They're showing results. They're showing positive results. She went from liquid-only diet to ability to chew her foods, again with jaw mobility. There was a myriad of therapies, which include hyperbaric, craniovisceral, acupressure, DMSO, IV, and stem cell therapy, including neurological, IV vitamins, and neuro rehab done in tandem. But I do believe acupuncture was instrumental for my mother's road to recovery. We'll update again as we see more progress, looking for mobility in arms and legs to walk again and speak more. So in some of my other cases, it was only acupuncture. One thing, it's just like in the Western medicine world, the sooner you get treated, like as soon as you have a stroke, go to the hospital and they'll get you stabilized. In this particular case, that wasn't the immediate case. She was in another country and we weren't able to, I did not start seeing her until close to a year later. So I want to make that very clear. So I have seen patients where I was able to treat them within a couple of days and they were able to, you wouldn't even know that they had a stroke. They're moving, their hands are moving, their symmetry, they have full range of motion. And then there are those who I don't see them until later, months later, and the treatment, the progress is slower. Well, in this case, even though I didn't get to see this patient as soon as I would have liked to because she was not in the country, um, and it was quite a while until I had seen her, the progress this woman has made is, in my opinion, tremendous. I do ask the daughter to take pictures of her legs. She's showing more strength. This is it's a pretty severe stroke. She's not independent. And that's why I'm so grateful for this particular testimonial, because there are mild strokes and there are severe strokes. And this is pretty moderately severe. She's wheelchair bound. We're going to get her walking again. So if you know of someone who unfortunately suffered a stroke, get them treated right away. Go to the hospital right away. In this case, she just didn't get the immediate Western medical care that she should have gotten where she was. But it is what it is. When she got here to the States, she was able to get the correct care with the physicians. And she's been, like the daughter said, on a myriad of therapies. But she, according to her, when I talked to the daughter, she sees the changes, the positive changes that the acupuncture gives her. So if you know of someone who may not be healing as quickly as they should post-stroke, or maybe just had a stroke, have them stabilize that person, and as soon as possible, bring them to the acupuncture clinic so then we can start with the healing process. On a side note, this is my own humble opinion. In 26 years of being a practitioner and seeing all kinds of, health issues, when it comes to neurological issues, acupuncture, hands down, is not just because I practice it, but hands down is probably the best thing for anyone suffering. I saw a dog who was paralyzed walk into the clinic, and the person who was working on this dog did some energy work, and this dog was able to walk out. And I was so amazed by that. I've seen the same thing happen with acupuncture. I've seen the same thing happen with acupuncture with Bell's palsy, Guillain-Barré, stroke, and some other things. It's such an important part of my practice, even though you may see a lot of videos on fertility or pain. I would say post-stroke patients have a near and dear part of my heart, because it is how I started my practice as an intern. And it is, I'm proud to say that at the time, I was Samahan Community Medical Clinics, both in Mira Mesa and in National City. At the time, I was their first licensed acupuncturist. And there's something about that Filipino diet that is not good for our sodium. It's not good for our sugar level. It's not good for our blood pressure. So as much as I love Filipino food, it is my heritage, it's not the healthiest. You got to really calm down with that sodium. Got to calm down with that salt. Got to calm down with that fried food. It's not the healthiest. I consider Filipino food to be, the southern comfort of Asia. It tastes so good, but it's not the healthiest. Like, I would say the more healthy foods in Asia are probably going to be Japanese food, Thai food, but Filipino food, as tasty as it is high in sodium and a lot of fried foods, but it tastes so good. And so there are other cultures where the food is kind of the same, really high in salt, and you couple that with, a very stressed out life. In this particular case, there was a tremendous amount of stress. Immune system high, stress low. You got to keep your stress low. Keep your stress low no matter what's going on. You got to keep the stress low, because having a stroke is not what you want. It's hard for many people to recover if they don't get the therapy they need right away, the correct therapy they need right away. If they don't see the physician, medical doctors right away to help them stabilize. Um, if they don't get acupuncture right away, that paralysis might be permanent. So consistent. I did if you go to elementsinharmonyacupuncture.com/momentum, you'll see I did momentum video, expectations video, and 6 accountability videos. You need to know how this works so you can get the faster results. If you go under once a week, don't expect any results. Not long lasting. That's like working out. You're going to work out here and there. Don't expect very much. If you go once a week, you're at maintenance mode. So if you like where you're at and you're going once a week, then just know that is maintenance mode. If you have digestive issues or anything, hormone issues, pain issues, neurological issues, if you're going once a week, just don't get upset at the practitioner. You're not going as frequently as you need to, because if you go 2, 3, or 5 times a week for 2 to 6 weeks, you can get yourself to 50, 80, 90 to 100% better faster. You're going to get it done within weeks, as opposed to drawing out 3, 6, 9, 12 months and saying this isn't working. You got to be very frequent with it. Okay, so under once a week, don't expect anything. Once a week, you're in maintenance mode. 2 or 3 or more times a week, you're being aggressive. Now, when you are at 100% for 2 weeks, don't just stop. Go another 2 weeks at once a week, and then go once a month for 5 to 9 months. I just basically gave you some secret to my success. So good luck to all of you. If you have had a stroke, or you know someone who recently had a stroke, or if you want to prevent a stroke, please come visit us at elementsinharmonyacupuncture.com. We have some amazing doctors, and I'm also working, and we do our best to be available 7 days a week. And we also have a phenomenal neuromuscular sports / massage therapist with over 20 plus years experience. We used to work at Burke Williams together in Mission Viejo since 2003. She is one of the most talented body workers in the nation. So come see us. We are here to help you out. Take care.